Hey, everybody. Hope that you are having a fantastic day. We are very excited that you're here for the Medicare Educational Workshop. This might look familiar. Maybe you received something like this in the mail, and maybe you even signed up, or maybe you didn't get a chance to, or something came up and you missed it. Well, that's okay because that is what today's session is for. Now, I'm not going to be the person facilitating this. In fact, that will be Wayne Heuman, and he's going to be with you here in just one moment. But first, we just want to make sure that you are as prepared as possible to make today's workshop session as informative or as helpful as possible for you. So we want you to know that if you are nearing age 65, that today's Medicare workshop is going to be wildly helpful to you. And in fact, Wayne has an opportunity for you, especially if you live in South Carolina, to be able to schedule and have a face-to-face appointment for him to be able to help you on a one-on-one basis. We'll also provide you with his direct phone number and give you a way to be able to contact him to answer your questions. With that being said, we're excited to be able to have Wayne Heuman with you today. I am his wife, Heather Heuman, so I can tell you that I have seen firsthand how he has been showing up for his clients, helping them over the years since 2016 when he formed and created his company, Palmetto Senior Benefits of South Carolina. So with that being said, get out some pen, maybe feel free to take a couple notes. This won't last longer than just maybe a shy minutes, longer than around 30 minutes or so. So grab your sweet tea or grab your beverage of choice and get ready to enjoy this video. If Wayne says something that kind of catches your eye, feel free to hit the pause button and write down your question. And again, you'll have an opportunity later where he'll be able to share with you his direct contact information, as well as a very simple QR code for you to scan for you to be able to set up an appointment. So with that being said, here we have Wayne Heuman to deliver today's Medicare Educational Workshop.
All right, thanks for attending this educational event. We're going to get started here in a minute, and we're going to take around 35 minutes, and I have a recording alarm set because my wife is a speaker and she says it's very important to keep on topic. So we're going to start. So very excited about this event. My name is Wayne Heuman with Palmetto Senior Benefits. I work in South Carolina, all over the state, going really anywhere from Charleston to Myrtle Beach to Greenville. And I value meeting with people face to face. This is an educational event, so it's very highly regulated by the government. So I'm going to read a couple of slides. Today's workshop has been filed with CMS, the Centers for Medicare and Medicaid Services. CMS has rules and regulations that we must follow when discussing Medicare Advantage and prescription drug plans. The presentation will only cover general information about original Medicare, Medicare Advantage, Medicare supplements, and prescription drug plans, as everyone's needs are different. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your options. This event is only for educational purposes, and no plan-specific benefits or details will be shared. Agent is not connected with the federal Medicare program. In this informational presentation, our purpose is to inform the general public on a general subject or class of products. If you are interested in specific information about specific products, please request an insurance company created product information approved by the Department of Insurance in your state. All right, so we got that out of the way. Try to make this as fun as possible, yet as informational as possible. I'm going to have this very unbiased and just stay with the facts. Medicare can be very confusing. A lot of times they call it the alphabet soup for a reason. You got parts here, plans here. So I'm going to just give you just the basic information and keep it straightforward and help make it less confusing for you. So we're going to start with original Medicare, Part A and Part B. That's the building blocks of Medicare and was kind of designed to have additional parts with it. But this is the start. So Part A covers hospital costs and Part B covers medical costs. Part A is generally no cost for most people, and Part B is changed each year by the federal government. It's currently $164.90 for most people. And if you're drawing Social Security benefits, it'll be taken out of that Social Security check for you. Some people will pay less for Medicare, Part B, if they have low enough income, and they could have what they call IRMA, income related monthly adjustment amount, if you have a higher enough income. And basically for one individual, that would be if you have an income over 90,000 a year, or if a couple over 180,000 a year. And then you could have a surcharge and pay extra for your Medicare Part B, and they would notify you of that. So there's basically 5 main choices of Medicare. You can start with the employee or retired group coverage. That'd be if you're working through your job and you have insurance that way. And you could also have military TRICARE benefits. So anything kind of employee or retired group coverage. And that's kind of one of the more common ways. But so if you're still working, you could continue to keep on your employer benefits and delay Medicare. So a lot of people are kind of confused by that and think that they might have a penalty if they don't start Medicare Part A and Part B right away. But as long as you have credible coverage, and your human resource department should be able to tell you that if you have the credible coverage, then you can delay your Medicare Part A and Part B. Probably wise to at least have Medicare Part A because it's no cost, and that might reduce your cost sharing. But at least have the Medicare Part A, and then once you stop working, then you could, within 63 days, go on Medicare Part B and not have a penalty. Another way is to have the Medicare supplement, or it might be called a Medicap policy. There's all kinds of different letters for that. Plan G is probably the most common right now. There's several advantages to the Medicare supplement that I'm going to go over. And if you do that, you generally want to have a Part D plan. So as long as you have some type of credible coverage with your Part D, then you can avoid the penalty. And the penalty can be kind of confusing. It's kind of a complicated formula. But if you had no Part D plan, then you can have that penalty. It's basically 0.01% times the amount of months that you didn't have a drug plan times the national average of a drug plan. So you really don't want to have that penalty. That'll be for the rest of your life that you do have a drug plan. But sometimes you can avoid that, like if you have credible coverage through maybe the VA or you don't want a drug plan. But one way, one other method or reason to have a Part D plan is you can only add that at certain times. So you don't want to be stuck in the middle of the year wanting a drug plan and have to wait to the next year to get it. Excuse me. So another way to have Medicare would be what they can maybe consider takeover Medicare, or having another option, the Part C in the Medicare Advantage plan. A lot of times you see that advertised pretty heavily, especially in the fall, with Joe Namath or one of those guys. So that's an all-inclusive model. There's different versions of it, and I'm going to go into a little more detail what that offers. You can get a Medicare Advantage Part C with a drug plan, or sometimes without a drug plan. And then another common method is if you have Medicaid and Medicare at the same time. So on the Medicap policies, there are 40 different companies offering the exact same thing. So they're very federally standardized. When you go into Medicare Part B for the first time, you're in an open enrollment. So this is kind of one of the decisions you want to make. You don't want to kick it down the road, because at age 65, when you first go on Medicare Part B, you're in that open enrollment. They can't charge you more based on your height and weight, whether or not you smoke, or your health, what medicines you take. And with the Medicare supplement, there's several different advantages to it. It's more of an all-inclusive model of health coverage. So There is no network. You can go to any doctor that accepts Medicare in the United States. And there's some kind of disadvantages to it as well. It doesn't come with a prescription drug plan, so you need to get a standard a drug plan separately. And there's 25 different options currently in South Carolina for a standalone drug plan. And then basically an agent can kind of look and show you how to look up medicines or look them up for you and kind of determine which plan is best for you based on your particular needs. And then on the Medicare Advantage plan, there's 7 different companies currently, and they're offering 41 different types of plans. And Medicare Part A and Part B, it's very highly regulated with an Advantage plan. So the Medicare Advantage plan has to offer at least at a minimum what Medicare Part A and Part B would have. And then in most cases, it's going to cover some of the remaining 20%, in some cases, all of it, as to where you have a certain copayment when you're done. Since this is an educational event, I'm going to talk about a few different definitions a lot of you have heard of. Copayment, that's the amount of money you will pay in exchange for services at a doctor visit. Deductible, that's the amount of money you must pay before the plan starts. Network, this is a list of providers associated with a specific plan. And the plans have an out-of-pocket maximum. This is a maximum amount of money you will be responsible to pay for your medical expenses. That's excluding prescription drugs. So in effect, the supplement plan does have a maximum out-of-pocket. With a Plan G, you would meet your deductible, whatever is set by the government for the Part B for that year. And then after that, you would have no more co-payments when you go to the doctor, surgery, hospital, regardless of how long you stay, as long as Medicare deems it's medically necessary. So we'll kind of talk a little bit about colors because the kind of experts say that might help you remember, and we want to make this as educational or positive as we can. So on the blue side, the Medicare supplement or Medigap policy, any doctor that accepts Medicare has to take it, regardless if it's one company or a different company. So the Medicare supplement plans are highly regulated. They're going to be kind of the same coverage. The difference is the cost. And after you meet your Part B deductible, there's no cost for any medically necessary bills. The Part B deductible is currently $226. And I mentioned there's the out-of-pocket maximum in effect because essentially there's no additional cost. You must add a drug plan. If you, there's not a penalty if you don't have a drug plan, but if you don't have any type of credible coverage, then later you could have one. On the green side, we have the Medicare Advantage Part C plan. There are some networks. The HMO, you're basically limited to that network of doctors, or if you go to that doctor and they're not in network, then you effectively have no coverage. And with a PPO, it's a bigger network generally, and then if they're not in the network, you can still go to that doctor, but you might pay a little bit extra. You do have some co-payments and co-insurance when you have a Medicare Part C plan. Most of those plans do not have a deductible, the Part B deductible. There are a few that do have the deductible and some different benefits to it. There is an out-of-pocket maximum. It can really range from anywhere from $2,900 to $10,000. Most of the time, the Part D plans do have a drug plan in the plan, so it's more of an all-inclusive model. This is kind of an idea of kind of what they are. On the blue side, either way, Part A is going to be no cost for most people. Medicare Part B is $164.90, and surcharges could be available with the IRMA. Social Security would let you know, and they would look back at your income from 2 years prior. And if you do have a surcharge, then and your income went down, then I can help you fill out those forms. We've helped out thousands of people with that form. We kind of know how to process that. Plan G is probably the most popular supplement plan currently. The Plan F, you had to have turned 65 before January 1st, 2020. And the reason why we like the Plan G is it's the only plan that does not have the excess charge. So doctors are regulated by the government that they can only charge a certain amount, but the plan, any other plan other than the Plan G, allows the doctors to charge that, and then you would be responsible for that. But Medicare Part G, the Plan G, will get rid of that excess charge. And it's kind of around $100 a month. There's, like I said, 40 different options, 40 different companies. So they can all charge kind of what they want, and not only what they charge starting out, but then going forward, different companies raise their rates a little more than others. Medicare Part D, kind of the average is around $13. There's some plans a little bit less, sometimes a little bit more, and it kind of depends which one's going to make more sense for you. If you take a lot of medicines and more expensive medicines like the ones you see on TV, then it might be worth paying a little bit higher monthly premium. So the Medicare Advantage Part C plans, there's different plans, HMO and PPOs, and HMO SMP, that stands for special need plans. Ultimately, you'd still have the Medicare Part A at no cost. You would have the Medicare Part B charge. Some plans will pay your Medicare Part B, or part of that, depending on where you live, based on the county you live, and it could be less based on your income. And I can help you figure that out and apply for that if you'd like, if you think you might qualify. And then some plans, maybe if you give up some options like maybe a prescription drug plan, then these companies, the Part C companies, will help pay part of your Part B premiums. There are plans that start at no cost, and the general range is up to $15 currently. So there are plans that you got to pay a little bit more, but generally those are outdated plans that they just kept available, but are probably less effective plans anyway. So it just kind of depends what you like to have, your health needs, and what's important to you. One key thing to remember, when you first go into Medicare Part B, you're in open enrollment, and you can get the Medicare supplement, guaranteed issue. They can't charge you more. But after a year, maybe 2 years, then if you wanted to go to a Medicare supplement, then you would have to go through medical underwriting, and they could maybe charge you more or just flat out cover you. The Medicare Advantage, you can switch at least once a year to a different Medicare Advantage company or a different plan if you'd like. It's just a little bit harder to go from a Medicare Advantage to Medicare Supplement. So always keep that in mind. So these are what the Medicare Supplement plan offer. In red, it's highlighted the main thing. Every other plan other than the Plan G charges that Part B excess charge. But basically the Plan G, it would cover once you meet your deductible. Then after that, you have no further charge when anything medically necessary. The Medicare Advantage plans, they do have the federally standardized benefits. It has to cover at least what Medicare Part A and Part B would have, but then after that, then the plans kind of vary a little bit and have different copayments. If you do like the Medicare Advantage plan, the green side, there's several things to consider. One of the main things probably is to cover in medicines. Each company has their own formulary and own tiers of what they cover. So keep that in mind, and have an expert like myself to help you look up medicines and kind of see. So a lot of times when it's highlighted, maybe in a Medicare new book or online, they show all the Medicare Advantage plans kind of show the same things and price and the co-payments, but they don't show you a lot of factors that are important, like the network, customer service, the prescription drug plans, how they compare to your own particular medicines. Most of them don't really talk about initially, like the dental and vision benefits that you might get. You might say, oh, you get dental benefits, but it doesn't talk about what those are. So you want to make sure that your plan covers your doctors and your networks. And even if you don't work with me, it's important to work with a local agent in a lot of cases, because a good agent should be able to review your plans and make sure it fits you personally, and kind of review more than one. If somebody shows up and they have a business card with one company logo, that's probably a sign that they're not there to work for you and kind of act as a fiduciary. And if you call one of the 1-800 numbers you see on TV, you're generally going to get somebody that's not familiar with the local plans. And just as importantly, they're not going to be there to review your plan going forward each year or be able to answer questions. So a lot of times your health is going to change over the years, the insurance companies, they change as well going forward. A lot of times they change each year. And you would want somebody to kind of review your plan going forward and kind of be aware of changes in the market. So on the Medicare Advantage side, this kind of gives you a snapshot of what the plans are like. A lot of the plans are no cost anymore. There are some plans, as you can see, that $103 a month, but like I said, that plan probably isn't going to be any better for you than the $0 plan in most cases. So if there was one particular plan or company that had the best all-in-one plan, it'd be very easy for everybody, but it's kind of a give or take. If you have a maximum out of pocket that's lower, then you might have a higher deductible, things like that. So you kind of look and see which one's important to you. We want to make sure that an agent is licensed, ideally in the state of South Carolina, familiar with the South Carolina plans, and verify that they're appointed to work different carriers. A lot of times people say, oh, I'm an independent agent, but that might mean they work with one or two of their favorite companies and they're not acting as a fiduciary for you. You want to make sure that they don't have a bias towards one plan or the other. If they're carrying in information from only one company or on their business card, then they might not be working for you. And then make sure that they're there to answer questions going forward. I personally will get on the phone call with the insurance company with you if you have questions that can't be resolved. And I generally can escalate things a little bit higher than just the individual. So that's an important thing to consider. If I can call and resolve things by myself or answer a question I can't, then I will. But sometimes because of HIPAA, then I have to have you on the line as well as a client, but I'm more than willing to do that for you. I just try to minimize the calls to 2 o'clock in the morning or things like that, which has happened. But I want to let you know that commissions are standardized by Medicare. It's very highly regulated. Each of the Medicare Advantage companies have to pay an agent the same amount, so an agent isn't playing favorites or recommending one company over the other because of commission. If you were to use an independent agent such as myself, I act as a fiduciary and you don't pay any extra for my service. I don't charge you anything. You don't pay more because you used an agent, but the insurance companies, if you enrolled in a plan through me, they would give me a commission. So a couple of the important things that often are kind of confusing is, how do I even start going on to Medicare? So if you're not collecting Social Security, then you have to proactively enroll into Medicare Part A and Part B when you want to. So you can either go to Medicare.gov or you can call Social Security to schedule an appointment. Probably want to call them about 90 to 100 days before your birth month. That way you can go in and get your Medicare Part A and Part B enrolled, and it can take 1 to 2 months or maybe even 3 months on occasion. So, you just want to make sure you have everything in place so you don't have any issues. You can call the National Call Center at 1-800-772-1213 or the local Social Security office, and I'd be glad to enroll you in the Medicare Part A and Part B myself. Very easy for me to do. I've done that quite a quite a few times. But if you are drawing Social Security, then the government assumes you're going to want to go on Medicare Part A and Part B, and enrollment is automatic. They're going to send you a Medicare Part A and Part B card in the mail about 3.5 months before your birthday. If you do not want to have Medicare Part B, then you can send it back and kind of make a check mark. But be very careful. Most people do want to have Medicare Part A and Part B if they're drawing Social Security. And if you say that you do not want to have Medicare Part B, then it's a little bit harder to get it back in a timely manner. So this here is my contact information. I'd be glad to receive a text, call, or an email, whichever is easier. So the big thing is to kind of decide if you want to go on to Medicare Part A and Part B, if you're working, if you want to delay Medicare Part B, or if you want to go on it right away. I can meet with you as soon as it's convenient, even if you're not going on Medicare for a while, and just kind of help understand all the options and kind of what the benefits are and if it's wise to go on Medicare Part A and Part B, and then kind of give you an idea of kind of the total cost of things. So I'm going to have a link to schedule appointments. You can kind of schedule more information, get different questions asked. I do have a retirement newsletter you can ask to receive. And we very, very much appreciate you watching this, and just contact me when you have questions. And right here on the slide is the barcode, the scan code to go and have a calendar link to schedule appointments. My phone number again is area code 803-908-0777.